Okay, my name is Kimberly Poole, and this is my audience for my informative and persuasive speeches. Can you see her now?
I sure do.
My name is Kimberly Poole, and I am presenting a speech topic today for my informative speech on how to start an IV. This is from my speech requirements for communication 1010, section 11482. I have chosen how to start an IV as my topic. The first thing that you would need to do is let your patients know what's going on. Starting an IV is a very skilled art form that is learned, practiced, and takes lots of skill to be able to do. You have to be taught these skills. First and foremost, you should always follow your hospital or clinic's policy and procedure. Different hospitals use different supplies, different clinics have different things that they may do for their IVs. Check your doctor's orders, make sure of what fluids you'll be giving, what rate, to make sure that you are supposed to be giving IV fluids so that you're not doing practicing medicine without a license. After you've done those things, you would want to gather your supplies, and you would need your IV catheters, your tourniquets, your alcohol preps or chloro preps depending on your hospital. You would need IV tubing connectors and your IV fluids. And you also need tape because you'll have to tape your IV after you get it in your patient. To begin, explain to your patient what you're going to be doing, why it is necessary, and if you know the course of treatment, you need to explain that to your patient as well. The next step would be to pick which arm or wrist, hand that you're going to use. Apply your tourniquet, and you would choose your vein. After you've chosen the vein that is most appropriate for your IV therapy, you would clean your site with alcohol prep or chloro prep and the site and approximately 2 to 3 centimeters out from your site. After you've done that, you need to select your appropriate sized catheter. For an average size adult, an 18 to 20 gauge catheter is appropriate. Again, use whatever catheter is used by your facility. You would want to insert the catheter. You insert at a 30 to 45 degree angle to the skin. Once you see flashback into the hub of the catheter, you would want to stop advancing. You would then take your stylet out, which is the needle portion of your IV. Push the safety button and close your needle. This is for the safety of you and your patient, so you don't stick yourself or accidentally put it in the bed and stick your patient. Also, the people who take the trash or the sharps containers out of the clinic or the hospital, this also decreases their risk of being accidentally stuck with the needle. Once you've received your flashback and you have sheathed your needle, you would want to thread the catheter into the vein using your pointer finger and your thumb. Once you have inserted and your hub is flush with your skin, you would hook up your IV tubing and connector in a flush the vein to make sure that it is patent. IVs can be tricky. You can blow them, or if your patient has bad veins, they can blow as well. After this, you would hook up your IV tubing and your IV fluids. After you've done this, you would secure your site. Secure it well depending on what your patient is. If you have an infant or a kid or even a teenager, it's best to secure it with good adhesive tape and an onboard, because these types of patients are not used to having an IV and they can pull them out. If you have a dementia patient, it's also a very good idea to tape your IV where they cannot pull it out, because if they do not understand things, then they get confused, they will pull them out. After you've got your IV started and your fluids are started at the appropriate rate based upon your medical orders, you will, the main goal that you have is to maintain your IV. You want to watch for signs of infiltration, which is redness, puffiness, hardness at the site. Your patient may complain of pain, and that would be signs and symptoms that your IV is not working. That is the basic steps for starting an IV on an adult. I would like to thank you for your time today, and thank you very much. If you have any questions, you can see me after the presentation. I would also now like to record my persuasive speech that is also due at the same time, and it is on blood donation. Blood transfusions are a very necessary part of the medical treatment community, and without blood transfusions, many patients would die due to the conditions that they have. Every minute of every day, someone needs a blood transfusion, whether it's a baby, a child, an adult, a teenager, an elderly person. It does not matter. All populations need blood. The only thing that makes this possible is blood donation. We do not have a way in the medical community to mimic blood. It has to be real blood. Anyone over 17 years of age is available to give blood. If you are over 100 pounds and you are generally healthy and you want to help your community, you can donate blood. This is a way that you can give back, and it helps many people that have many different things wrong. Trauma victims, premature babies that have premature bone marrow and they can't make their own red blood cells and they get anemic. Leukemia patients, aplastic anemia patients, Chagas disease patients. These are the types of people that you can help with your blood donation. It's a very quick, very painless procedure. It is cleaning of the arm, a needle stick, and an hour of your time. You can donate every 8 weeks or 56 days, according to the Red Cross. Depending on your specific blood type, you may be able to donate for another member of your family that may need blood. Also, if you're going to have surgery, you can also donate for yourself in case you need blood during or after your surgery, and that way you can get your own blood back instead of getting donor blood. Some people would rather do that than get donor blood. The risk of infection with donor blood is very, very low. It is very tested. It is very safe. And the risk of infection that you would get from donating blood is minimal to none. They clean the sites very well with betadine and alcohol. Your blood is free to make, it's free to give, and anyone who wants to help the community can do this. For example, college students who need extra money. All college students need extra money, right? You can donate plasma, and there's a monetary payment for that. Plasmas can be broken down into several different things. It can be broken down into platelets, packed red blood cells, fresh frozen plasma, or cryoprecipitate. These are all components that we use in the medical community to treat our patients given their diagnosis or what's going on with them at that moment. Trauma victims usually require a lot of blood, especially if they've had lots of cuts or abrasions. Gunshot victims, things of that nature need lots of blood. If we did not have blood that was donated by donors for our patients, we would have thousands and thousands of people that died every day. This is a very useful thing. If you have a certain blood type, you may be called to donate when the supplies are low. As everyone knows right now, there is a shortage in Joplin, Missouri, where the tornado came through. That is an area that needs more blood. That is because they're having to use it on the people that they're treating. When Hurricane Katrina came through, there was a push for blood. Anytime there's a natural disaster, anytime that there's any disaster in the United States, there's a push for blood. If you are O positive, O negative, A positive, A negative, B positive, B negative, AB positive, or AB negative, it doesn't matter. Donate blood to help people. It is the main resource that you can give, and you can save a life. And it may be your own child's life that you save. As you can see, there are many benefits to donating blood. I would like to thank you for your time today. And if you have any questions, please see me after the presentation. And again, I would like to thank you for your time. You've been great. And thank you very much.